Joining us now to talk about some of these changes and what you can do to manage them is Dr. Elizabeth Wassenaar. We appreciate you being here. She's with the Eating Recovery Center of Denver, and very important topic to talk about. I know we just had World Menopause Day, so it's an important topic to highlight. Can you talk about how menopause has been described as kind of like a perfect storm when it comes to eating disorders, which is something a lot of people don't think about?
Absolutely. So normally we think about eating disorders in younger women, but actually eating disorders can affect women of all ages and in all shapes and sizes of bodies. And menopause is a particularly challenging time in a woman's life because your body is going through a lot of changes. And you may feel uncomfortable in your body, have hot flashes, feel hormonal changes. So it's a time when there can be increased stress, and oftentimes eating disorders can relapse or occur for the first time in the course of menopause.
Interesting. Yeah. Are there a lot of myths when it comes to menopause and you know what surrounds it? Like you said, eating disorder is probably one of them.
It is, yeah. So I think that most people really don't associate eating disorders with women who are of menopausal age. But in fact, women of menopausal age are going through a major life transition. And so I think a big myth is that they can't get an eating disorder or that they would be immune to that. But they're actually not. They are very vulnerable to an eating disorder and disordered eating in that time phase of their life. The other thing to remember is that women of this age are given advice to eat healthy, to exercise, to watch the size of their body. And for somebody that has a disordered relationship with their body, that can be very triggering. So they may actually experience that they start to fall into compulsive patterns with eating or with exercise that become very counterproductive and can cycle into a mental illness quickly.
Do you deal with a lot of women at your center that are going through menopause and battling eating disorder?
We certainly see women of all ages at our facility, those going through the menopause transition and those that are postmenopausal. I would say it's less likely for women who are in menopause to present to the highest levels of care for eating disorders here in Denver, but we certainly see that as the awareness that eating disorders can affect menopausal women, that they're seeking out help more frequently.
What advice do you have for women who might be going through menopause and are struggling with this and likely an eating disorder?
Absolutely. So I think it's really important that you're honest with your providers, your OB-GYN, your primary care provider, that you have a disordered relationship with food or your body so they can help you monitor that. If you have been in therapy or worked with a dietitian before, reestablish those relationships, let people know that you need support. And then if you are noticing that your time is getting taken over by thinking about the size of your body or what you're eating, it can be an important marker that maybe you need to get more help. And you can seek out resources both online and at eatingrecoverycenter.com. We can have a conversation with you if this is something you need to worry about.
Okay. Well, we appreciate you being here. A very, very important topic. So we're glad that you were able to come here and talk to us about it today.
Thank you so much for having me.
Yeah, absolutely. And take care. We appreciate it again. And